Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. There were two articles, they were side by side today, and looking at the headlines on them, the irony impressed me. So I thought I'd just do a very quick video just to surmise the situation regarding the NHS. So we'll take a look at the articles, and then you can decide if it's ironic or rather pathetic and sad. Anyway, let's have a look. So, National Health Service. Nearly 1,000 patients a day wait 12 hours plus in A&E. Ambulances take an hour to respond to heart attacks, and 10,000 urgent cancer referrals are not seen within 3 months. So, it's basically a death penalty for some of these people. More than 29,000 sick queued for half a day at A&E units in July, 4 times more than the NHS target. The proportion of patients seen within 4 hours dropped to 71%, the lowest rate logged since records began. Separate ambulance figures show average wait for a heart attack and stroke victims surpassed 59 minutes. And it goes on and on and on. I'm not going to go into all the details on here. You know as well as I do how bad the NHS is. One of the reasons is the 300,000 people a year immigrating into this country who haven't contributed a brass farthing, and yet almost immediately all go to the NHS where they're treated in full. And then they cause bed blocking and resource sort of jams and things like that. If you had someone at the gate of the hospital saying, and how will you be paying, national insurance, private insurance or credit card, a lot of these people would be turning around and hightailing it, because anyone with insurance certainly wouldn't be going to an NHS hospital. I had an experience recently. I had a video, I've done a video on that. It was the most traumatic event of my life. I'm not going to go into it here, but it was so bad, I'm taking legal action. So anyway, you got this terrible figures for the NHS. And we know, and it goes on and on and on. But it's basically saying how bad the NHS is. And that was one thing, and I saw that. So what was ironic about that? Well, it was the article next to it, which is this article. The NHS is still hiring diversity and inclusion managers who are paid £76,000 a year, despite Number 10 pledge to scrap the roles as part of the war on waste and wokery. That is, you're hiring a manager rather than 2 nurses, because that 76,000 is actually more than the cost of 2 nurses, which could possibly help the NHS. Far more, that's for sure, than a woke inclusivity manager. Because if you go onto an NHS ward, one of the problems you don't find is too many white faces. And this is because when you go in, you look at the nursing staff and the help, the aides, I can't remember what the term is, the care assistants. A vast proportion of them are black and Asian and Far East Asian, Philippines, that sort of thing, because they're cheap. Because training a nurse costs a lot of money, and the NHS hasn't got a lot of money. So what it does, it goes to poorer countries like the Philippines, who then pay the nurses to get trained. And then it steals trained nurses from these poor countries. Well, it means we get nurses, which is fine, but we get them very cheaply. But what it does mean is that these poor countries don't have any nursing. So you think it's bad here. Try going to a hospital in, say, the Philippines, where there's no nurses because they're all in the NHS, getting paid rubbish, I may add. Now, I'm not going to have a word said against the staff. The staff work very, very hard. This is the thing, when I said about my problems weren't the staff. My problem was a systemic failure. The people there worked hard. They just didn't attend to me. That wasn't their fault. It was simply that there were too few of them, and far too many people to be seen. I was in a ward designed for 4 people, and there were 6. And you can guarantee it'll be the same in every ward. So, I won't have a word said against the staff, won't have a word said against the nurses, the doctors, or anything like that. But the whole system is creaking. It's unfit for purpose. The whole system needs really to be torn down and rebuilt from scratch. But rebuilt with, I think, identity cards, health identity cards linked to your NHS number. If you don't have one of them, you don't get seen in the NHS. It's as simple as that. And can we stop stealing nurses from poor countries and pay to educate our own nurses. You know. Anyway, so the government is now paying, the NHS is now paying £76,000 a year for diversity inclusion managers, but can't hire a nurse. And I thought, ironic. Perhaps if we fired, I don't know, randomly 50% of all the managers, and then use the money saved to, I don't know, you know, buy equipment, hire nurses, get an extra doctor in, get a consultant in. Lives may be saved, lives may be improved, outcomes may be far better, waiting times less. Ambulances would turn up and actually save a life rather than taking the corpse away, as what happens a lot, especially in heart attack and stroke victims. By the time the ambulance has turned up, well, it's far too late. But hey, at least we've got a diversity manager. Anyway, I shall come up because I don't want to get angry about it. There are many things wrong with the NHS, but a lack of diversity managers is certainly not one of them. I do believe it does need a root and branch change. It needs to be rebuilt from the ground up. Regional basis, responsibility at every level, but not with management structure. You don't build a health organisation by management grades. You build it by having centres of excellence controlled by doctors. Sure, you need managers to control the ancillary staff and to do important things like ordering stock, you know, ordering products, ordering equipment. But you don't need paperclip managers and managers of paperclip managers and overseer managers for all the managers of the paperclips, you know, managers. It's that level of bureaucracy that's costing probably billions a year that doesn't need to be spent on crap. Anyway, it is what it is. We need to change it. We all know we need to change it. It's just a shame that no government will ever have the balls to do it. Anyway, I'll stop there. If you like what you hear and see on the channel, please hit the subscribe button if you haven't already. Ring the bell for future notifications of output. Leave a like, leave a comment, and until next time, stay safe, stay well, don't get ill, don't ever get ill, and goodbye.